Hello and welcome back to my YouTube channel. In this video, we will cover our journey in understanding diabetes mellitus further by discussing in detail about the etiopathogenesis of type 1 and type 2 diabetes mellitus. And as always, comments, questions and healthy discussions are always welcome in the comment section below because knowledge shared is wisdom gained. So let's go. So let's start by understanding about type 1 diabetes mellitus. Type 1 diabetes mellitus is defined as an autoimmune disease in which islet destruction is caused primarily by immune effector cells reacting against the endogenous beta cell antigens. Now, there are two major causes for type 1 diabetes mellitus. It can be due to genetic susceptibility or environmental factors. What are the genetic factors in type 1 diabetes mellitus? Genetic factors in type 1 diabetes mellitus can be broadly classified into HLA associated genes. Now in HLA associated genes, they contribute to 90% of the type 1 diabetes mellitus susceptibility, of which HLA-DR3 and DR4 are seen in 90% Caucasians and 40 to 50% of other subtypes. DR3 or DR4 in combination with the DQ8 haplotype has one of the highest inherited risk for type 1 diabetes mellitus. The second major classification is non-HLA associated genes, in which there are polymorphism of variable number of tandem repeats which is present at the promoter region of the insulin gene. But how they cause diabetes mellitus, the mechanism is unknown. There is also polymorphism in the CTLA4 and PTPN22 genes. And there can also be germline defects in the genes that encode for AIRE or autoimmune regulatory proteins. When it comes to environmental factors in type 1 diabetes mellitus, the single most common important environmental factor is viral infection. Now what happens in viral infection is there is formation of something called viral epitopes by the virus. These viral epitopes will be molecularly similar to the islet cell antigens. So they exhibit a phenomenon called as molecular mimicry. Now what happens in molecular mimicry is they tend to cross react. Now what happens with cross reactivity? There will be islet cell injury, and that can cause type 1 diabetes mellitus. Now it is very important to understand that type 1 diabetes mellitus just doesn't manifest itself immediately once the disease sets in. There is always a lag period between initiation of the autoimmune process and appearance of the disease, which leads to the three stages of type 1 diabetes mellitus, as you can see in this chart. The stage 1 is normoglycemia, wherein it is a pre-symptomatic stage. So here the individuals are at risk for the type 1 diabetes mellitus, but frank symptoms have not set in. The stage 2 is called dysglycemia or the pre-symptomatic stage again, wherein the individuals are still not showing any frank symptoms of diabetes mellitus, but what happens is there is loss of the beta cell mass at this stage. So here there will be loss of glucose which is present. This progresses to stage 3, which is a symptomatic stage, and this is where the symptoms usually appear and the patient is type 1 diabetic. So the fundamental abnormality in type 1 diabetes mellitus is failure of the self-tolerance in T cells specific for islet cell antigens. Now because of the failure of self-tolerance of T cells specific to islet antigen, you get activated T cell. Now this activated T cell is formed due to development of autoreactivity. Autoreactivity occurs because of one of the two ways. Either there is a deletion of the self-reactive T cell or failure of the effector T cell to get suppressed by the regulatory T cell. So these activated T cells will travel to the pancreas and there they will cause beta cell injury. Now These activated T cell can be one of the two subset. First is Th1 cell. Now this Th1 cell, they will cause beta cell injury by secreting cytokines. The next subset is CD8 plus T cell, which directly kill the beta cell without secreting any cytokines. After understanding the etiopathogenesis of type 1 diabetes mellitus, let us now understand the pathogenesis of type 2 diabetes mellitus. There are various factors that contribute to type 2 diabetes mellitus. The first is genetic factors. Now, in genetic factors, 90% concordance is usually seen in monozygotic twins. That is, if one twin is affected by type 2 diabetes mellitus, it is very likely that the other twin will also be 90% at risk for type 2 diabetes mellitus. 5 to 10% risk is usually seen in first degree relatives. Genetic studies have been done on at least 30 loci, most of which are present in the adipose tissue, that contribute to the adipose tissue function, the beta cell function, and they are known to have an increased risk for development of type 2 diabetes mellitus. Now, amongst the environmental factors, the single most important risk of type 2 diabetes mellitus is due to obesity, especially central obesity. Apart from that, you also have sedentary lifestyle, that is a lifestyle without much exercise or much activity can cause type 2 diabetes mellitus. So, there is a syndrome which is called as a metabolic syndrome, which is a combination of obesity, hyperglycemia, increased serum cholesterol. They all contribute to this phenomenon which is called as a metabolic syndrome. Apart from that, sleep disorders and circadian disturbance, that is a disturbance in your circadian cycle, can also cause type 2 diabetes mellitus. The other factors are insulin resistance, obesity like we have discussed, and beta cell dysfunction, which I will discuss in detail in the further slides. What are the metabolic defects in type 2 diabetes mellitus? So, they are of two major types. One is insulin resistance. Insulin resistance can occur due to failure to inhibit the gluconeogenesis in the liver. So, that would lead to increased blood sugar levels. The second factor is failure of glucose uptake and synthesis in the skeletal muscle. So, like we discussed in the glucose homeostasis, this always happens following a meal. So, what happens is there will be increased postprandial blood glucose level. The third is failure to inhibit the activation of hormone sensitive lipases in the adipose tissue. Now, what will that lead to? That would lead to increased triglyceride breakdown. So, that would lead to increased circulating free fatty acid. The second most important factor is beta cell dysfunction. How does obesity, the single most important risk factor for type 2 diabetes mellitus, contribute to it? As we discussed in the previous slide, central obesity is always more dangerous than peripheral obesity when it comes to diabetes mellitus. Now, when a person is obese, there are three products which are released. One is adipokines, the second is free fatty acids, and the third is inflammation. Now, all these three we will discuss now in detail how they contribute to insulin resistance. We'll start with free fatty acid. Free fatty acids always have an inverse correlation with insulin sensitivity. What do I mean by inverse correlation? Let us try to understand. Now, what happens is whenever there is increase of the free fatty acid, they tend to overwhelm the fatty acid oxidation pathway. So whenever they overwhelm the fatty acid oxidation pathway, there is accumulation of three important products. One is DAG, the other is PL or phospholipases, and the third is SPL or sphingophospholipases. Now these tend to attenuate or diminish the insulin signals. Now what happens is whenever there is diminishing of the insulin signal, there is activation of the inflammatory pathway. This activation of inflammatory pathway tends to cause beta cell abnormalities. Now we must understand that insulin by itself leads to diminishing of the gluconeogenesis. How does it diminish the gluconeogenesis? It diminishes it by diminishing the phosphoenol pyruvate carboxylase enzyme. Now what happens is this phosphoenol pyruvate carboxylase will be activated in type 2 diabetes mellitus. That would lead to increased gluconeogenesis. Coming to the next factor, which is adipokines. Adipokines are nothing but adipose cytokines. So, adipose cytokines work very similar to cytokines. Either they initiate hyperglycemia or they act through two factors. One is leptin and the other is adiponectin. Now, adiponectin and leptin usually decrease the blood glucose levels. But what happens is adiponectin's levels decrease during obesity. So that will contribute to increased insulin levels. The third factor is inflammation. Inflammation, what happens in inflammation is pro-inflammatory cytokines are released. Now these pro-inflammatory cytokines, they are secreted due to obesity. Now what happens is this pro-inflammatory cytokine plus your increased free fatty acid, they contribute to beta cell dysfunction and insulin resistance. Now what happens is these two, pro-inflammatory cytokine and free fatty acid, they release something called as inflammasome. Now this inflammasome tends to secrete something called as IL-1 beta. Now this IL-1 beta will secrete IL-1 cytokine. This IL-1 cytokine releases the pro-inflammatory cytokine. Lastly, how does beta cell dysfunction contribute to type 2 diabetes mellitus? We must remember that this beta cell dysfunction will always lead to a phenomenon called as overt type 2 diabetes mellitus. Now, beta cell dysfunction is caused due to various factors. One is lipotoxicity. Lipotoxicity occurs due to increased free fatty acid. The second is glucotoxicity. Glucotoxicity occurs due to hyperglycemia. The third is amyloid deposition. The fourth is genetic polymorphism. And the fifth is abnormal incretin effect, which we discussed in our previous video, wherein there is decreased GLP-1 and GIP. So I hope you enjoyed and you've understood a little bit more about type 1 and type 2 diabetes mellitus, its etiopathogenesis in detail. Now stay tuned for part 3 where I'll cover the clinical features and complications of diabetes mellitus. I hope you liked this video. If you did, please like, share and subscribe to my YouTube channel, and I'll see you in the next video. Bye bye.